Hi guys, this is Nikki, lead vet tech with Posh, and today let's go over therapy and rehab for a dog knee injury, what we're doing during this therapy time, and what exactly it entails. So first off, our goal with therapy, especially rehab for a knee injury, is to reduce pain and inflammation, get more mobility in the joint, have, increased range of motion, things like that, enhance proprioception. So proprioception is where when we have our foot flat on the floor, it should stay like this. If we curl those knuckles under and the foot stays, that's called low proprioception. So proprioception, when we knuckle basically our dog's back leg, it should flip over immediately. So it should immediately do that. If it does not, that means that they've got issues and proprioception problems. So we want to strengthen those muscles. We want to help them be able to tell when their foot is flat and when it's knuckled. So hopefully we can get some of this coming back. Now, sometimes low proprioception can be like a nerve issue, hopefully one that is reversible. But it can definitely happen when they have a knee injury as well, if there's swelling or any inflammation around that nerve. We also want to prevent further injury. So when we've got an injury in one leg and we're not using that leg, we're overcompensating, right, on our front legs and our other back leg. So it's really important during physical therapy to strengthen those other legs so that they can take that pressure, which is another reason we like to use a brace on that good, or not good, but the injured side, so that they're not overcompensating as much. So we also have a lot faster recovery time with our patients that do rehab and physical therapy. They're able to, get bounced back to doing normal activities a lot faster. So what do we do with our physical therapy? What kind of things are we doing with our program? So rest and controlled activities. So this initially, especially with our Posh clients, is going to just be leash walking. A lot of times, sometimes we'll do some passive range of motion, where we're gently bending those joints and getting them, some mobility. We don't want them to recover really stiff. So whether you have surgery or you do bracing, those joints, once they start forming that scar tissue, will be stiff and hard. So we really need to be working those joints, doing passive range of motion, strengthening those muscles. Leash walks are great where they're bending and relaxing. We also want to take care of pain management. And so I have a lot of blogs that we've done on different things you can give them for pain. We just want to make sure that your dog's comfortable and they're not hurting. Therapeutic exercises, like I mentioned, like physical therapy. They might do water therapy where they have them in an underwater treadmill. We might just be doing passive range of motion. So those are all great things. Assisted exercises. So there might be some where we have like a sling under their tummy and we're helping them walk and helping them do like up and down squatting type things. So those are always good as well. Active exercises. Sometimes they might be having them go up ramps, or I call it a football ladder, where they have strings that are elevated off the ground and the dog has to pick those feet up and walk through them. You can get those for like $12 on Amazon, by the way. So those are all things that we do during physical therapy. And what's nice with Posh is we include videos and a 12-week program that you can do at home with your dog, so you don't necessarily have to go in and have physical therapy. But if you do have that access, I always recommend it, because you've got a clinician there working one-on-one with you. They know your dog, they're in the hydrotherapy tank with them, and they can actually, make sure things are going smoothly. If you have any questions, it's PoshDogKneeBrace.com. My email is poshintakenumber1@gmail.com. Thanks and have a great day. Bye-bye.